Yes, sir.
Okay. So there is a presentation in your, there is a PowerPoint.
Yes, sir.
Okay. So let's start.
Okay, sir.
Okay. So today's class is cardiac arrest and pulmonary resuscitation, cardiopulmonary resuscitation. So cardiac arrest is, there is no, when there is no cardiac activities, when it happens suddenly, sometimes we may establish the cardiac activity after cardiopulmonary resuscitation. We call it CPR, after CPR. So if the patient is fell down with no pulse, no cardiac activity, and if you think that this patient can be survive after CPR, then you may heartbeat and cardiac function, resulting in the loss of effective circulation or absence of systole, failure of the ventricles of the heart to contract, usually caused by the ventricular fibrillation, with consequent absence of the heartbeat, leading to the oxygen lack and the eventually death. So it is sudden onset, and there is a loss of cardiac activity, and there is a, when there is a loss of cardiac activity, then there is no pulse, and if there is no pulse, then you may start CPR, cardiopulmonary resuscitation. So it might, there is few steps to go to the cardiac arrest. First of all, there might be something wrong with the cardiac. Yes, either there is a ventricular tachycardia or other things. Then that ventricular tachycardia may change into the ventricular fibrillation (VF), VT change to the VF, and then cardiac arrest. That is usually that is a pathway. Okay, usual pathway. Then how to diagnose? It's a loss of consciousness or unresponsiveness, loss of normal breathing, apnea, loss of pulse or the blood pressure, apical and the central pulsation, and caloric and the femoral loss. So please remember that if you see some patient just falling down with no response, please don't start CPR immediate, because there might be other causes. So because there might be other causes rather than cardiac arrest. So if you think that, okay, this is a cardiac arrest, whenever you establish the diagnosis of the cardiac arrest, so start CPR on time. Early CPR may save the life. So early CPR, proper CPR with proper defibrillation, that may save the life. So please remember, not all the patients who are unresponsive, who are unconscious, and who fell down, they might need CPR. एउटा चाहिँ मुटु चलिरहेको ठाउँमा CPR त गर्नु भएन. So you cannot do the CPR whenever there is a cardiac activity. Okay, so first of all, you should know the status of the patient, and that is called in Nepali what we call, it's the patient is Dolio. Are you listening me now? Hello?
Yes, sir.
Yes, sir.
And this is the status of the Dolio. Okay, first of all, you see the patient, that patient lost. So symptoms of the cardiac arrest, that's the cardiac arrest symptoms are immediate and the drastic sudden collapse there, no pulse, no breathing here. Respiration arrest may be in 30 seconds after the cardiac arrest, loss of consciousness, and there is a pupillary dilatation. We call it enlargement of the pupils. It may be in 90 seconds after cardiac arrest. So if there is no pulse, no oxygenation, and whenever your brain, the brain of the patient, your patient is stopping working, the activity from the brain is not there, then the rest of the clinical feature will come up there, and then once you start the cardiac CPR, then you may establish these things. But remember that you cannot establish the full circulation with CPR. तिमीले कहिले पनि CPR गरेर 100% जुन perfusion हुन्छ, the 100% perfusion cannot be established. So it can go up to 30% only. It can go up to 30%. Please remember, this is consequences of the CPR. So you cannot establish 100% of perfusion. You can establish only up to 30% of the perfusion with CPR, 1/3 of the perfusion with CPR. That's why you should do the CPR in lying position and better in the head down position to establish the perfusion first to the brain. So brain may die right after 6 to 8 minutes after arrest. So the first is you should establish the perfusion to the brain, to the heart, to the lungs, to the liver and the kidneys. So these are 5 vital organs. First of all, you save the vital organs, then the body. Okay. Remember the basics. Cardiopulmonary resuscitation consists of the use of the chest compression here and the artificial ventilation to maintain the circulatory flow and the oxygenation during the cardiac arrest. So CPR, basically there are two. One, you compress the chest. Yes, the chest compression. I'll come how to compress and how fast and how strong. Okay. Then another one is airway maintenance. Okay, then the first of all, you go for airway, see the airway, maintain the airway, go for the CPR and establish the patient. Although the survival rates and the neurological outcomes are very poor for the patient with cardiac arrest, orally appropriate resuscitation involving orally defibrillation. Please remember, this is a vital points here. Orally appropriate resuscitation and orally defibrillation and appropriate implementation of the post-cardiac arrest care lead to the improvement of the cervical and the neurological outcomes here. And there is a terminology chain of survival here. Chain of survival is the first you recognize the patient. Okay. So the cardiac boss part so you should recognize the patient whether that patient may need a CPR or not. The second is the proper position. The third is the immediate start of the cardiac CPR. The fourth is immediate start of the defibrillation. That is called a basic life support, and then go for the active life support. Then if the patient is responsive now, effective, or there is you establish the cardiac activity, then you can shift patient to the hospital or to the cardiac unit or to the ICU. So that is a chain of survival. Early access of the care, know the sign, early CPR, cardiopulmonary resuscitation, especially with the quality chest compression here, rapid defibrillation with the AEDs and the electrical shock to the heart, and effective paramedics, yes, advanced life support here, and follow up the care, post-cardiac arrest care. So this is the life chain support. Then when you start the CPR here appropriately, then what patient may think, clear? So this is a life support. This is a life support here, the chain of the life support. You recognize the patient, you ask the friend, your friend or helping hand for start the CPR, go for the defibrillation, go for the hospital in ICU setup. So this is the chain of survival. And how to do CPR here, for how many hours or for how many times, and it's depend on either you are a single rescuer or the double rescuer. I have a good slides. It's taken from the 911 the American Society of Critical Care. Slide also. Then you can see that also later on. So if you are alone, then you start the CPR. Then after certain compression, suppose 30 compression, then go for the breathing. Again, you start the CPR, go for the breathing, like this. If you are two, then that's much better. So you continue compression and continue the breathing. Please do not. If before 2011, if we start the CPR, then what we asked to do when we were in MBBS, okay, go for 30 CPR, 2 breath, then again 30 CPR, 2 breath, stop the compression. No, now it's not like that. It's like you continue the CPR, you continue fast and hard. It's up to 100 pulse per minute, and then continue the breathing. Up to you may go for 50:2 if the adult, or 30:2 if the adult, or the 15:2 if the children or the infant here. Okay. Then outline, you can go for the introduction of the CPR, how to introduce the CPR, review the cardiac circulatory system, causes of the cardiac arrest, CPR and AED. This CPR should be performed immediately on the person who became the unconscious is found to be a pulseless. The important is here the pulseless. Please remember that the pulseless. Assessment of the cardiac electrical activity via rapid rhythm strip recording can provide a more detailed analysis of the type of the cardiac arrest as well as indicate additional treatment options here. Loss of effective cardiac activity is generally due to the spontaneous initiation of the non-perfusing arrhythmia here, sometimes referred as a malignant arrhythmia. So then SELS is active cardiac life support here in the hospital setting when the paramedics or other advanced provider is present. SELS guideline call for the more robust approach to treatment or the cardiac arrest, including the following here: drug intervention here, ECG monitoring, defibrillation, invasive airway procedure, in 2016. The resuscitation begin with a few minutes. Many of these individuals have a chance for survival. So then to begin the resuscitation within a few minutes, patient collapse witness here, emergency system immediately activated, CPR started immediately and defibrillation within a minute. So these are very important things here. Trained bystanders are not always available or willing to do the CPR. This is a very important thing for the community, for the locality. So we are only 25,000 doctors in the Nepal, and only 8,000 are actively participating in the treatment of the country. So these 8,000 doctors may not be available in all the situations when we need a cardiac CPR. So then what government is doing right now, or what WHO is doing right now, is to give a training to the community personnel. So to develop a rescuer among with the policemen, among with the other social workers, among with some these general people. So even in Nepal also we are giving the training of the CPR to the general public. The role of the rescuer is critical in reaching the patient quickly and beginning the resuscitation here. Okay, so this is a BLS, basic life support healthcare provider. Yes, it's from pediatrics here, but again I'm telling you, this is a verify the scene safely here. Victim is unresponsive, blah 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 blah. Then look for breathing. If no normal breathing has pulse, then go for only. If he has a pulse, then go for monitoring of the pulse. If the pulse is okay, there is no breathing only, go for airway management and take the patient to the ICU. And if the pulse is decreased with the breathing, then go for CPR here. Monitor, then normal breathing has pulse, but patient is unresponsive, monitor until emergency responsive alive here. Then arrive. If they come, then shift patient to the ICU or other things. So what this chart shows, not every unresponsive patient needs CPR. So circulatory system, it circulates the oxygen and the nutrition to the peripheral organs here. Okay, the main thing is that. So it delivers the oxygen and it removes the CO2 in circulatory system here. And the function of circulatory system is very survival. If you do here lack of O2 or the accumulation of waste product quickly, then it's lead to the death. Then we call it Morio. Patient Morio. Okay, so we can restart physio. So we can start the CPR here. So I'm removing these things here. So then what blood. The blood of the fluid of the circulatory system here and carries O2 and the nutrients. The most important here, O2 and the nutrients, and it was of the waste from the heart. So this heart physiology, you please remember that it maintains the pressure and maintain the cardiac activities pulse. So when we start the CPR, our aim is to maintain the blood pressure and to maintain the pulse here. So then time is critical again. So brain damage begins in 4 to 6 minutes. 4 to 6 minutes. So we should start cardiac. We should start CPR within 4 minutes to prevent the brain from the damage. Brain damage is irreversible. It's irreversible in 8 to 10 minutes. So if we delay it more than 10 minutes, so we cannot survive the patient. So there might be a brain death, but patient may come up with some cardiac activity. And sometimes we saw some patient, they are in ICU for a couple of days with cardiac activities, and there is no any signs from the brain. So there is a sign of brain death. It shows that we delayed the CPR, and but we established the cardiac activity, but there is no any signal from the brain, and unfortunately we will miss the patient here. Yes, so circulation must be restored within 4 to 6 minutes here. Other is provide minimal amount of circulation. So this is very important. Yes, CPR is provide the minimal amount of circulation. So we cannot provide the full perfusion, 100% perfusion. We will provide only 1/3 of the perfusion, up to 30%. So oxygenation until cause of the cardiac arrest corrected. Or we can give a circulation, we can give the oxygen until the cause is established or the corrected. Once the cause is corrected and there will be a normal activity, then we stop CPR here. External chest compression circulate to the blood, and artificial ventilation provide the oxygen here to the lungs. Causes is a heart disease here, respiratory arrest, medical emergency is here, yes, downing or the suffocation. So usually in winter season, we saw so many patients with cardiac arrest or with unresponsiveness due to what in Kathmandu. Whenever they are living in one room with a small bathroom. Can you imagine? Anyone? Hello? Anyone can say why more and more patients there are more and more patients came to the emergency with unresponsiveness usually in winter season. The situation whenever they are living in one room with a small bathroom. I'm telling you again. Why? Can anybody tell me? So this is there is a terminology of CO2 narcosis. So they used to use these things. What is that called? Geyser? Yes, gas geyser, and there is a lack of oxygen. So there is a carbon dioxygenation, and there is a high carbon monoxide, and they may develop the carbon dioxide poisoning. So then they may. So this is the suffocation here, okay? And congenital heart disease and the trauma. So this is some causes of the cardiac arrest here. The cause of cardiac arrest is important, but do not delay the CPR to obtain the history. अब त्यो इमर्जेन्सीमा आएको छ, तेरो बाबुलाई के भयो भने तेरो बाबुलाई चाहिँ भनौँ न त्यो के अरे डायबिटिक छ कि छैन, हाइपरटेन्सन छ कि छैन भनेर सोध्न थाल्यो भने त, so you may lose the patient. So history is very important, yes, whenever your patient is stable, but when your patient is not stable and you establish the diagnosis of that's the cardiac arrest, and you please do not delay the CPR, you go for the CPR immediately, okay? Go for the CPR immediately. Do not obtain history here. It's a combination of the external chest compression, I told you before, also with the artificial ventilation, and it's provided of 30% or the less normal circulation. So it's depend on how effective you are doing the CPR. If you do the most effective methods, then you can establish up to 30% circulation only, and only effective for the short period of the time. It doesn't mean that you do a CPR for 2 days or 2 months. No. So there is a cycle. So you may go to 3 cycles, 5 cycles. After a certain period, if you can establish the cardiac activity, then you should say that, okay, sorry, I can establish this one. So yeah, this is if you are alone, then and you first of all you recognize the patient, keep the patient on proper position, and start the CPR. Open the airway here, look after the airway. If listen and feel the breathing. If there is no breathing, you cannot listen. So if there is no breathing, give to breathe, each lasting 1 second here. Yes, then you go come. You see the carotid pulse. If the carotid pulse is not here for 10 seconds, then go for the CPR here, go for the chest compression. So chest compression in between the sternum here, in between the sternum with the two heels here. Then if there is no pulse, find the landmark, lower the half of the sternum in between the nipples here. Then start a chest compression. So begin the chest compression here, okay, with this position. So perform 30 chest compression first of all. Here, push hard and push fast. So it should be at least 2 inches deep. And you please release fully your hand after compression to give the heart for fully recoilation. Heart to be fully recoiled and to accumulate all the fluids from the periphery or the blood from the periphery to the ventricles. Then again, whenever you are giving the second compression, that too goes through the aorta to maintain the perfusion, peripheral perfusion. So push hard and push hard. Allow the chest to recoil after each compression for this, and administer 2 ventilation, then return to the compression again. So go for the ventilation and again. So if you are 2 rescuer, then that's more better. So one will go for the compression, another one will go for the ventilation. So compression is around about 100 compression per minute and ventilation. So you can give 2 ventilation in 2:30. So it means, or if you think that okay, patient is unresponsive, then or sinute, then you may go for 15:1 or 15:2. Then if the patient is children, then use the heel here, single heel. Again, 30 compression and 2 ventilation alone. If you are 2, then you go for 1 is continue the ventricular compression, another one is ventilation here. So then infant, start with your fingers here and 30 compression with 2 ventilation again. What is the sequence of the survival? I told you here, the first to recognize the patient, take the patient to the proper position, start the CPR immediately, go for the defibrillation immediately, keep the patient in safe nature here for the ambulance and other things, and shift the patient to the hospital in ICU setup. This is a cervical, chain of the cervical. So if there is a broken in one place, then you may lose the patient. So effectiveness of the CPR may be lost here. The chain of the cervical from the cardiac arrest depend upon the sequence chain of the cervical beginning intact. All links are equally important, and one weak link can break the chain here. So if you maintain this chain of the cervical, you may save the patient, and you can say that Bachu. Okay, there was Dolio, Chichu, Moriu, and Bachu. The next one is sequence of the cervical recognition and early access here, early CPR defibrillation, and early advanced care. So keep patient to the there. So early recognition is very important. So it's depend on the public education. Emergency system must be immediately notified, and we need strong CPR center in Nepal. So we do not have a CPR centers in Nepal, official CPR centers in Nepal. Even in our college, we don't have a strong emergency team. Yes, emergency rescue team we call it. So even in Nepal, there is no emergency rescue team. Some of hospitals are starting to have an emergency rescue team, as in Grandi Hospital and Medicity. Yes, but we don't have these things here. So then actually this to be there. So then another one is early CPR must begin within 4 to 6 minutes to establish to protect the brain from the hypoxia. Public training is very necessary, and just have a critical role here. Okay. Then another one is ventricular defibrillation is most important. This is a defibrillation here. So it looks like a film in Amitabh Bachchan to have a 2 defibrillator or 2 plates, like iron plate, yes, usually. Then to give a big source and to save them. No, it's like Piazza right now. It's just 2.5 kg, and it's very portable, and you can take it everywhere right now. Ventricular defibrillation is a common cause of the arrest, so you can correct with the defibrillators here. Okay, you can give it. You should give the charge. It goes through the SA node to the V node here. Okay. Then chance of the success and decrease with the time, and AED saved the life here. Okay, this is a ventricular defibrillation, the most common cause of the cardiac death here, and this can be established only with defibrillation, not with the pump. Okay. Then in ventricular defibrillation is immediate defibrillation, CPR, and then window of the survival here. Okay. Early advanced care medication here, advanced airway management and post-resuscitation care to be maintained here, and patient immediate to be shifted to the ICU or CCU. AED, this is the automatic external defibrillation here. So I saw you the picture, the same things here, safe and accurate and the lightweight, again, easy to operate, very easy. And what is the public access is of the defibrillation. So usually it is in the, if you been to first countries, then it is on the, so it kept in the special place of the public place or the hospital setup or other setup here even, and usually it's practicing in Germany or in Netherlands. So it is available very frequently here. AED. Then this is AED is public in public place here. AED in the public place again. So it's very frequent in, I told you also in Europe, training the public in CPR or the AED. So this is to be done. It's special consider for the children because there is big patch. It should be very small patch. Okay, cloth. You should remove all the cloth. You should remove the body here. And you should make the patient dry. Yes, and you should remove the transdermal medication or the patches, or sometimes patient may be with some pacemaker and other things. So you cannot go for these things here. Implanted defibrillator or the pacemakers, you should remove it, metal surface and the jewelry and the glasses. So all to be removed, everything to be removed here. Okay. So this is AED, yes, automatic external defibrillator here. Very good picture again. And there are two patches, and you can give these are two patches, and you can give the patch on proper place here. Okay. The first of all, you check the patient here. Yes, for AED, you check the power, you check the patient, analyze, and give the shock. This is the chain of the AED. This is the chain of the AED. Okay, this is turn the power on, first of all. Okay, then you give the patch on the proper place, apply pad to the patient here. Okay, then you check the machine here, and everything is okay. Then you go for the shock, give the shock. Okay, so this is the AED here. Then again, after AED, you check the pulse immediate. If the pulse is not there for 2 minutes, then immediate go for the CPR again. Do not give AED. In summary, it's a continual breathing or the contracting of the heart is necessary to keep the blood circulating throughout the body here. Brain damage in 4 to 6 minutes of the cardiac arrest. There are many causes of the sudden cardiac arrest, but most common is a ventricular defibrillation. And please remember that it can be corrected only with defibrillation. Yes. Okay. Survival from cardiac arrest depend on the sequence or the chain of the survival here, and rescuers are critically important in maintaining the sequence chain of the survival here. And lastly, if you shock the patient, yes, you can save the patient, then whatever you will get, the price is Thichi Mario. Clear? Hello? Hello?
Yes, sir.
Sir,
So is there any question?
So the defibrillator ले कति volt को current दिन्छ?
So it's depend on, so if you are going, if you do with the defib, so it's depend on what you are doing, and depend on the patient also. Usually this is 8 to 16 here per month as power, and but it's better to go with the 8 only. Okay, but this is a very good defib. It's very available everywhere there. पहिला त्यो अमिताभ बच्चनको फिल्म जस्तो हुन्थ्यो हुँदैन, त्यहाँ चाहिँ ठुलो हुन्थ्यो ड्याममा हाल्दा ढ्याक्का हाल्दा ढङ्ग उठ्थ्यो हैन, त्यस्तो हुँदैन. It's not like that. Usually it used to be around about 20 to 25 kg before, whenever we are student even. Now it's not 20 to 25 kg, it's just 2.5 kg, up to 2.5 kg only. So this is defib here. Okay. Any questions? So if you do not have any question, this is all for today, okay? And sorry for today's class. I was not informed that I had a class at 9:30. So later I got a call from